Hello and welcome to another episode of Iranian Surgery Podcast. And this time we are going to talk about Brazilian butt lift. You should keep in mind that cosmetic surgeries have a direct impact on your daily life. And therefore, aside from the price and quality of work, a natural and excellent result is very important. This operation uses liposuction to remove fat from the patient's body and inject it into their buttocks, which in turn causes a lift and increases the volume of the buttocks. This operation, unlike the use of prostheses, which can be risky and dangerous, is very low risk and can achieve the desired shape of your buttocks at the same time as you drain fat from different areas of the body, including your abdomen. The approximate time you need to stay in Iran is 1 week, and the overall recovery is 3 to 4 weeks. What is a Brazilian butt lift? Brazilian butt lift surgery, or BBL, is a fat transferring procedure that improves the fullness and shape of the buttock using your own fat. Liposuction is performed in the areas that have excess fat, typically the abdomen, sides and hips, and/or lower back, to both improve the proportions and contour of the lower body and harvest fat to be added to the buttocks. The collected fat is then purified and prepared for grafting before your plastic surgeon strategically injects the fat into specific areas of your buttocks to create a fuller, more defined shape. This method has usurped traditional operations like butt implants in popularity for its natural looking and fully customizable results. Brazilian butt lift advantages and disadvantages. Now, what are the advantages? Brazilian butt lift surgery can help overcome the effects of genetics by reshaping the buttocks and surrounding areas, such as the hips, lower back, and thighs. You might consider a Brazilian butt lift to enhance the curves of your lower body, reduce fat pockets on your hips, thighs, or belly while adding fullness to the buttocks, help clothing fit more attractively, give a more youthful, aesthetically pleasing shape to flat buttocks, enhance your overall proportions by improving balance between your upper and lower body, and unlike other forms of buttock surgery such as placement of silicone buttock implants, a Brazilian butt lift is touted for providing more natural looking results while also creating more roundness in your backside. It can also help address certain issues such as the sagging and shapelessness that sometimes occur with age. Another benefit to Brazilian butt lift is that there's a lower risk of infection compared to silicone buttock implants. It does have a better safety profile than other substances such as silicone caulking and sealants that are sometimes illegally injected into buttocks by people not qualified to perform the procedure. And here are the main disadvantages of this procedure. A Brazilian butt lift is a great option for many patients. However, not every patient is a candidate. Patients that are thinner may not be ideal candidates for this procedure due to the fact that they don't have enough fat on their bodies. Fat absorption may be as much as 40%, which may produce asymmetry, making this procedure more difficult to predict and requiring additional fat grafting sessions over time to attain the desired look. You also need to consider the recovery process. Because you are having fat injected into your buttocks, you will be limited on the amount of time that you can spend sitting down while your body heals. Additionally, your doctor may also recommend that you don't wear tight pants in order to ensure that the fat grafts are properly absorbed into your body. How is a Brazilian butt lift procedure performed? Liposuction with suction tubes, or cannulas, is used to remove fatty tissues from areas of your body with excess tissues such as the abdomen, hips, back, or thighs. The fat is then processed for fat transfer. The fat is re-injected using syringes connected to cannulas. Usually, 3 to 5 small incisions are needed for injecting the fat, but these incision sites are easily hidden by clothing. The fat is grafted in layers at multiple levels, with the cannula moving back and forth to ensure that a smooth, linear deposit of fatty tissue is left to reshape and augment the buttocks area. The liposuction incisions are closed with sutures. Drains are inserted and a compression garment is worn following surgery. Not all the fat transferred in BBL procedure is expected to survive. The final result may be somewhat smaller than initially projected. Repeat BBL procedures, a second or third round, are occasionally advised depending on a patient's initial results. While popularly called a butt lift, the BBL procedure is primarily about improving body torso contours, improving the waistline, reducing back rolls, and providing a more curvaceous figure. Skin is not removed in a typical BBL, and the lift effect is primarily an increase in projection of the buttocks. Recovery time frame after Brazilian butt lift surgery. It is vitally important that you follow all patient care instructions provided by your surgeon after Brazilian butt lift procedure. This will include information about wearing compression garments, care of your drains, taking an antibiotic if prescribed, and the level and type of activity that is safe. Your surgeon will also provide detailed instructions about the normal symptoms you will experience and any potential signs of complications. It is important to realize that the amount of time it takes for recovery varies greatly among individuals. Hope you enjoyed listening to our podcast. Our goal is to give you a short and needed information about each procedure. For more information on this subject, you can visit our website iraniansurgery.com or contact our consultants. Stay with us for more podcasts.